Exercising during your pregnancy is good for many reasons. Exercise will not only help physical and mental well-being, but assist in birth preparation. Achieving good muscular strength and joint mobility may assist with a quicker postnatal recovery. This video will show you a selection of exercises that you can do at home. Simple equipment such as a mat and Fitball or chair can be used. Your core supports you during exercise. Exercise 1. Gently draw your pelvic floor up inside and notice that your lower abdomen draws inwards as well. Practice a few times turning your core on and off, and then draw up and hold. You should be able to maintain this contraction for a few seconds and breathe at the same time. Set your core this way at the start of each exercise and stop if you feel yourself letting go. Remember to pause and allow the core time to relax between exercise repetitions. Exercise 2. Start in the same position on your hands and knees and activate your core to prepare. Slowly reach your left arm and right leg outwards whilst maintaining the stability of your trunk. Your spine should stay in neutral as you reach and return back to the starting position. Then repeat on the opposite side. Reach your right arm and left leg outwards. If you feel unstable or if your back arches, begin with just your arms or just your legs. Exercise 3. This wonderful stretch allows you to move through the whole spine. Breathe out as you curve and breathe in as you arch the back. Do 2 sets of 10 repetitions. Exercise 4. Separate your knees comfortably and reach your tailbone back towards your heels. You can stay there and breathe, or reach one hand over the top of the other to create a small side flexion in your back. Hold for a few relaxed breaths. Swap to the other side and repeat. You can stay there and breathe, or reach one hand over the top of the other to create a small side stretch. Exercise 5. Start lying on your side. Keep the shoulders, pelvis and heels in line and with your knees slightly bent in front of you and the waist lifted slightly away from the floor. Keeping your heels together, lift your top knee in the air and hold for 5 seconds. Only lift to the extent that your pelvis doesn't move forwards or back. Lower the knee down and repeat 10 times. Now repeat on the other side. Exercise 6. Straighten out your top leg and lift it into the air with your toes pointing forward. Aim to lift just above the line of your pelvis. Hold it there for 5 seconds and repeat 10 times. Now repeat on the other side. Exercise 7. Continue lying on your side, bending the knees back up. Reach the arms forward with the palms of the hands together and gently activate your core. Reach only the top arm up towards the ceiling and then turn the chest as you stretch back. You may or may not be able to roll far. Keep the knees together and your hips facing forward. Avoid stretching into discomfort or straining the shoulder. Hold the stretch and breathe 3 or 4 times. Then lift the arm back up to return to the start position. Repeat 5 times on each side. Exercise 8. Sitting on a Fitball or chair, find your upright posture with both feet secure on the ground. Tuck the tailbone underneath and then tilt the other way. Move the pelvis forward and backward within comfort to stretch the lower back and pelvic region. Repeat this 10 times. Try then to take the pelvis around in a circle, keeping the shoulders fairly still. Move 10 times one way and then repeat in the opposite direction. Exercise 9. These exercises release the upper back and gently stretch the arm and chest region. Start by rolling the shoulder back and then open the elbows outwards like you're opening the windows. Straighten the elbows to lengthen the biceps. Finish with the celebration stretch, clasping the hands behind your back if comfortable. Hold this stretch and breathe, slightly lifting the chin, and smile. Exercise 10. The last exercise is a squat, which you can do from sitting in a chair or from standing. Hold your spine tall and flex at the hips as you bend the knees, maintaining the natural curve of your back. Ensure the tailbone is moving backwards into the squat and avoid the knees drifting forward. Push up to standing by keeping the weight even and squeezing the thigh and buttock muscles. Start by doing 10 of these in a row and work up to repeating this set 3 times. Remember to keep breathing and gently activate your pelvic floor muscles.